I'm Tom McCoy. I am from Nevada. I think most of you heard that yesterday. The tongue depressor comes into my scope of vision. Watch out, doctor. The wing bite x-ray film is sliding into my mouth. Stand back, dentist. What am I talking about? Gag reflex. I have a very aggressive gag reflex. And you say, what's that got to do with the cost of care? Well, we're going to find out what it has to do with the cost of care. Now, most people understand that prescription drugs impact substantially the cost of care, especially for chronic diseases. You get over surgery, you get over treatment, you're still taking prescriptions for some people for the rest of their lives. And so it does add up. But what millions do not know, and some of you do not know, is there's an unnecessary cost of care associated with prescription drugs. And to explain all that, I've got to talk about the middlemen. Do you know about the middlemen in the prescription world? Well, you're about to hear about the middlemen. The middlemen are pharmacy benefit managers. Have you heard about PBMs? Okay, well, we'll talk a little bit about PBMs and how they impact the cost of care. Now, there are three major PBMs: CVS Caremark, Express Scripts, and Optum. And they control 80% of all prescriptions. 80%. So these are important folks. So we got PBMs. What do? Well, they negotiate pharmaceutical prices with the manufacturer on behalf of the health plan. They establish those things called formularies. We all that have health insurance, we know about formularies. PBMs put those together. Sometimes they select prescriptions that are higher priced because they get a better rebate, even though there's a cheaper alternative. So this is a little bit of information about the PBMs, and we'll find out that PBMs are in the gag reflex business. And I'll explain that. When the PBMs negotiate a contract with pharmacies, quite often, in most states, they do something called a gag clause. And that gag clause says, pharmacist, you cannot tell the patient, the customer, what the cash price is. So, here's an example of what happened to me and what we did as a result. I was changing health plans and had to go to a 90-day situation. And meanwhile, they said, you can have a couple of months of 30 days. So I go to the pharmacy to pick up 2 prescriptions, $20 copay for each, so it's $40. I was prepared to pay $40. And the pharmacy tech who knew me said, I'm really not supposed to tell you this, but why do you want to pay $40? I said, what's my alternative? And she said, less than $4 if you pay cash price. I said, well, wait a minute. There's a difference of $36? And she said, yeah. Okay, where does the $36 go? It goes back to the PBM. So I want you to think about this. $36 times 12, let's say that I had to take this prescription for a year. It's about $500. Multiply that by millions in this country. We're talking billions of dollars, and this has been going on for several years. So what we did in Nevada, we got together with chronic disease groups. We had LLS, we had diabetes, we had arthritis, and we had heart and cancer, and anybody we could find. We got together and we said, let's try to get some legislation going here. We found, and this is why you should never discount a political party just because, oh, well, they won't support it. We found a conservative Republican to take the bill in a Democrat supermajority House of Representatives Assembly. We passed it. Now, we didn't get everything we wanted. We got the gag removed from the situation, but we were unable to get the cash price being applied to the overall deductible. We'll try to do that next year. So I pass along to you the gag reflex that I started with, and just ask you the next time you go to a pharmacy, check that pharmacist gag reflex.